Nearly time. Here we go. I know you can do this. You know you can do this. So you just go out there and show them what you've got. You go, girl, and have a great shift.
Staff Nurse Conway. Who were you talking to?
No one.
Go out there and show them what you're made of. What's all that about? Where do you think you are? Wembley Arena?
Yeah, sorry.
Talking to yourself at your age. You need to be at least as old as Charlie before that starts happening. Oh, and by the way, as nice as it is, we don't do big hair in the NHS. Would you kindly tie it back?
Thought you were going to help. This grave's full of weeds.
Dad, it'll still look like a grave whatever you do to it. What I'm saying is she wouldn't care whether there are weeds or not.
I care.
She's somewhere so beautiful, you couldn't even begin to imagine it.
Right, you made your point.
I'm off to college now. I'll be home in time for supper. It's chicken curry. You get the rice ready, I'll do the rest. Oh, by the way, I love you.
Hello there, Mrs. Tennell. What can we do for you today?
I had a splitting headache, Doctor. But it's easing now, so I feel a bit foolish.
Oh, don't feel foolish. It's our job. Do you often get headaches?
At least once a day.
What sort of time of day, morning or evening?
Any time, really.
And how long do they last?
An hour or so.
Okay. Follow my pen for me. Do you ever suffer from dizziness or nausea? Flashing lights, loss of vision?
No, but
What?
I keep hearing noises around the farm, as if someone's trespassing.
Oh, you work on a farm, do you?
I own a farm.
None of our Robs?
Heart rate 79, temperature normal, BP 180/20.
180/20?
120/80.
Cute. You sleeping okay?
Not much. I tend to be a bit jumpy at night.
Why is that?
I've been burgled a couple of times.
Ah, sorry.
Every time I hear the slightest creak, I think it's happening again.
Well, insomnia can certainly lead to headaches.
You don't think it could be a tumour?
Seems unlikely. Let me run a few tests for you first. Let's get a full blood count, use an EASE, and let's get an ESR as well, please.
Hiya.
Charlie here. My car's broken down and I've taken it into the garage, so I am on my way, but I am currently stuck in traffic and it's solid. But I will be there as soon as humanly possible. Okay, thanks. Don't you honk your horn at me, you. And you, chum. Put a sock in it.
Oh, wow. Wow. I'm coming. Stay right where you are. Message. What message?
Sorry, I'm just struggling to find a vein.
I'm pretty certain I've got some.
Thank you. I've been burgled before. It's horrible, isn't it? It really sets your nerves on edge, especially at night.
How are we doing?
Yeah, I'm just trying to get a sample. Thank you.
You finally got round to tying your hair back.
Oh, come on, Scarlett, you can do this.
Look, I'm not being funny, but could you take over?
She's almost there. What did I tell you?
7 jabs later.
All right, so the clue is help from heaven, question mark.
How many letters?
2 words. First word's got 6 letters, second word's got 12 letters. First word starts with a D, second word starts with an I and ends in N.
Divine intervention.
Blimey, how'd you get that?
I've got this secret weapon, Jeff. It's called a vocabulary.
Control 23006, call from Blockwell Bridge onto a car, young female, query neck and leg injuries, over.
3006 received, over on our way.
Yeah. Hold that, brains.
Just lie still if you can. Try not to worry. Ambulance is on its way. It'll be here very soon. Okay, try not to move, just in case anything's broken. What's your name?
Maya.
My name's Charlie. I'm a nurse.
I knew you'd come.
How would you know that?
I was trying to get to Raphael.
Sorry?
You know, one of the 7 archangels.
Oh, that. Raphael.
Is he still on the bridge?
No.
Sometimes it's just hard to find a vein. Stop beating yourself up about it.
But you heard her. She wanted you to take over. It's not exactly a vote of confidence, is it?
Scarlett, you have to learn to rise above these little setbacks. Take Charlie. There's a man who's been stabbed, demoted, sacked, and even shot. But he never takes anything personally. Drink your tea.
Well, all your tests have come back normal. And in my view, you are as strong as an ox. I think it's the anxiety over the break-ins that's stopping you sleeping. And the headaches are a symptom of that.
Okay.
So go home, get some rest. I will write a letter to your GP and ask him to chat to you about your sleep. In the meantime, I think we can safely rule out the brain tumour theory.
Thanks, Doctor.
Okay.
Okay, this is Maya, 18. She fell about 20 feet. She's KO'd, possible fracture to her right ankle. BP stable at 130 systolic, pulse of 90, temperature 38.4. Good use of Entonox. Pupils are slightly dilated.
Number 2, please.
Zoe. She says she saw an angel on the bridge.
Okay.
Do
Sorry.
you think anything's broken?
Well, we'll know more when we see an X-ray. Let's get 5 milligrams of morphine IV. What made you climb onto the bridge, Maya?
I was trying to rescue a cat.
Okay. And what made you fall?
I'm not sure. I think I blacked out.
Anything like this happened to you before?
Don't think so.
Your pupils are slightly dilated. Can you think why that might be?
I haven't taken anything, if that's what you mean.
I'm not judging you, Maya. We've all been young, you know.
I don't do drugs. Don't even touch alcohol.
You want any kind of medication?
No.
Don't like that temperature. Are there any other symptoms you've had recently? I don't know, maybe a cough or problems on your pee?
No.
Has she had any paracetamol, Charlie?
No.
Okay, let's give her a gram and do some bloods. And, could you also do a chest X-ray and an MSU? I'll chase up a CT scan just to be on the safe side.
Why didn't you tell the truth?
Are you kidding? Believing in angels. She'd have me down as a total headbanger.
Maya, what on earth happened?
do you think you're doing?
Robbing your gaff. What's it look like? What's more, you ain't gonna do a thing about it.
How dare you threaten me in my own home?
That's how I dare. Now, get back upstairs.
You best do what he says. What if she calls the cops?
Let her. We're almost finished here anyway.
Put that down. Now.
Come on then. Let's see what you got. Thought so. Probably isn't even loaded.
Sean, wait!
You shot me, you crazy old bag.
I told you to keep still.
Keep still? With you pointing that gun in my face.
Stop shouting at me. This is my land and you're the trespasser. Keep quiet now.
Shoot me again, why don't you? You moron.
If you don't shut up, I will.
You shut up!
Take off the mask. You're just a boy.
So, you're an artist? I used to have an auntie that was an artist. Well, she did painting by numbers, like, but I could never really work out what they were meant to be. Still, I suppose that's hardly the point, is it?
Do you see that?
Hmm? Oh, disgusting. Use a hanky.
You're the most beautiful thing I've ever seen.
Well, that's, thank you very much. I wouldn't go that far, but, you know, I do try to keep in shape.
What do you want from me? Just tell me.
No, steady on, all right? I'm very flattered. Well, you're a young girl. Hello? Oh, I'll fire. Can we have some help here, please? Thank you.
Sorry. Just trying to slow down the bleeding.
Like you care. You haven't even called an ambulance.
What's your name?
Rocco.
Your real name?
That is my real name.
I'm Brenda to know. My family have farmed this land for 6 generations.
So where are they now?
Pardon me?
Your family.
All gone, Rocco. And the last.
Thank God for that.
Rocco, I'll be honest with you. You and me are in a bit of a pickle. Do you realise that? If the police find out what happened here today, we'll both go to prison.
Oh, they'll find out anyway. They'll trace your shotgun.
No. It's unlicensed.
And you're in worse trouble than me, aren't you?
Doesn't mean you won't go on trial.
So what are we going to do?
Here's the story. You were out for a country walk, you got lost and you found yourself on my land. Then a masked man appeared from nowhere and shot you.
They'll never believe us.
We'll just have to make them believe us.
All right, Maya, just take it easy. She spiked a temperature of 40.
Her BM's normal, so it's not a hypo. God knows what this is. At least her scans come back NAD, so her head's okay.
Mr. Kemp, your daughter mentioned something about seeing an angel on the bridge. You don't seem surprised.
She claims she can see angels. Her paintings are full of them.
Is there any chance she could have taken cocaine?
Not as far as I know. But she's an art student. I don't seem to know who her friends are anymore.
Then we could be talking about a case of serotonin storm. Excess serotonin brought about by drug use. Let's get this temperature down first. Ice packs, a rectal temperature probe, get some fans weighing. We'll need to contact her GP too.
Oh, that's okay. I'm her GP.
You're a doctor? And you're treating your own daughter? That's against GMC rules, isn't it?
What I meant to say was, she's registered at my practice. I just keep an eye on things.
OK, Charlie, I'm going to contact ICU. Warn them that she might be on her way.
All right, darling. All right. Nice and easy.
I heard a shout, went outside and found a boy lying outside my house. He's hurt his leg. I don't know how exactly. He's about 15, no older than 16. Please hurry. He's in a lot of pain. Rocco? Rocco?
Let me sleep.
No, dear. Try and stay awake. Rocco?
What?
Why did you break into my house?
What is this? We're best friends all of a sudden. You've just shot me in the leg.
And I'm sorry. But you mustn't say that to the police. Rocco? Tell me what you're going to say.
A man in a ski mask came up to me. And then you shot me in the leg.
No. He shot you. You mustn't say that I shot you.
Yeah. I'm sorry. Looks pretty bad, doesn't it?
No.
It does. I'm screwed, aren't I? It doesn't matter. My life sucks anyway.
He's in there. Dr. Kemp, we're going to be here for a while, so if you want to go and get a cup of tea. Charlie, I'm going to go and do a bit of research, see if it enlightens me.
Right. We'll maintain cooling measures, do 15-minute obs, and I'll give you a shout if anything changes.
Yeah, cheers.
Okay, Rocco, can you hear me?
Stop shouting.
Sorry, me old son. I just need you to stay with us. He's tachycardic.
Okay, let's get IV access.
Okay, pain relief?
5 of morphine. This is a gunshot wound. Did you see the gunman?
No, just heard shouts, went outside, and there he was.
You still stuck your neck out? Good for you.
Sorry?
Well, you could have been attacked yourself, but you went out anyway. It's good to know there's still people like you around.
How'd you get that cut on your head, love?
Oh, I slipped on the stairs.
Okay, Jeff, can you pass me a big dressing, please, love?
Thanks.
Come on, Jeff, let's get a move on. Hello? Someone else in trouble?
I'll never raise but it pours, eh?
Any change?
Only for the worst. Heart rate's up to 160, temperature's 41.5.
OK, this is getting serious. The medics suggested starting on cyproheptadine to counteract the serotonin, but Charlie, feel her muscles. They've gone completely rigid.
What are you thinking?
This can't be a serotonin storm. Oh, let me think. Okay, high fever, rigidity. What else have we got?
It's not a hypo. Urine dip was NAD. Bloods aren't back yet.
Let's hope they can shed some light, because the chest x-ray's absolutely fine.
It's risperidone.
Sorry?
Risperidone. She's been on it about a month now.
Why didn't she tell us? Why didn't you?
She doesn't know, and I...
Haven't told her. Oh, well, that's just great.
She's fitting.
Okay, let's protect her airway. Get some lorazepam and start on dantrolene, 2 mg per kilogram. Somebody call ICU. She might need paralysing and ventilating.
Okay, this is Rocco, 15. Gunshot wound to the left leg. Lost approximately 2 litres of blood at the scene. He's had 5 of morphine and 500 of saline, and there's an occlusive dressing on the wound. Okay? 1-3, please. 1, 2, 3. Over. Pulse 110, BP's 126 over 76, and SATs are at 92% on air.
Thank you, Jeff. Thank you, Dixie. Can we get some large wound pads, please, and a betadine soak? Hello there, Rocco, is it? I'm Mr. Jordan. I just want to have a little listen to you. How are you doing?
How do you think I'm doing?
Good answer. Where exactly does it hurt?
You mean which leg? I'll give you 2 guesses.
It's okay, sarcasm I can deal with. Let's get the frat pack off, please. Does it hurt anywhere else apart from your leg? No. Okay, now just gently reveal the wound. Come on. That's it.
I'm sorry.
Oh,
Sorry.
okay. Take that one. All right, Rocco, let's get him 10 milligrams of morphine, please.
Scarlett. Scarlett.
All right. Okay. You're doing very well, Rocco. Pain relief will kick in shortly. Let's close this up. Start him on IV antibiotics. Let's x-ray the leg, please. I'll call up to orthopods, get them down before we redress it.
Scarlett, get cleaned up.
Good lad. Doing very well.
So what do you think really happened at that farm?
Well, I think he tried to break in. She shot him.
Poor kid.
Poor kid? What about her? She's a woman on her own. She's got a right to defend herself, hasn't she?
Well, my heart says yeah, but my head says no.
Don't listen to your head.
What, we're going to tell the police?
Well, hopefully they won't ask.
Excuse me, I'm D.I. Bain. I'm investigating the firearm incident at Willow Hall Farm. I believe you two were first on the scene.
It's your second visit today. You must really like it here. Not especially. You say you live on a farm? What's that like?
Peaceful. Apart from today.
And you're there on your own?
I would have loved to have had children. A bit late for that now.
That'd drive me up the wall. Living by myself in the middle of nowhere.
I'm the opposite. Fields and sky and big open spaces, that's my favourite thing. I hate feeling confined. Oh.
What is it?
I'm going to be sick.
It's okay. It's all right. Okay, let me get you a tissue. Brenda, I think you might have a little bit of concussion. I'm just going to go and get the doctor back to review you. What's that, okay? All right.
Down to 38. Looks like it's working.
Nearly messed that one up, didn't I?
But you didn't.
Dr. Kemp, I think you and I need a chat.
You need four for me, please? Oh, that hurt?
Nah.
What about that?
Ah! Oh! Clumsy geek.
I don't know who you're calling clumsy. You may have fractured a rib, and I need to make sure you don't have a collapsed lung. Let's get you x-rayed.
It's only blood, Scarlett. Yes, it smells awful. Yes, it's sticky and vile, but it's fine. We're all full of it.
You saying I'm full of it?
You scared the life out of me, you sod.
One of those days, eh?
It's not just the blood, Charlie, it's everything. The bedpans, the sputum.
Ah, sputum.
The lousy money.
The unsocial hours.
The way the doctors take all the credit.
I've got an idea. Why don't we all get together and form some kind of national union for nurses? We could fight for better pay, better conditions.
Yeah, sorry to break this to you, but...
Yeah.
BP 140 over 100.
Well, that's a little higher than this morning.
I hadn't seen anyone get shot this morning.
Good point. I'm sure it's just concussion, but the vomiting could indicate a more serious head injury. You don't seem to remember much about the incident, and your manner seems a little odd.
What about your manner?
His manner's always odd.
Right. Let's follow the clinically excellent guidelines of our esteemed National Institute and get a CT scan.
Mrs. Tunnell, the police wants to ask you a few questions. Do you feel well enough to talk to them?
I'm good with the patients, but bad at all the rest. I'm only half a nurse, Charlie.
You think so? I'll tell you what I think. I think you've got the half that counts. Or you could be like the diplomat of the year over there. Good doctor who nobody wants to be treated by.
I heard that.
Suggestion? Get stuck in. You can do this.
Thanks, Charlie.
So you heard yelling and you went out to investigate?
That's correct, officer.
And you didn't hear a shot?
No.
So you didn't realise at first that Rocco had a shotgun injury?
No.
You grew up on a farm. You must be familiar with firearms.
That's rather a stereotype, don't you think?
So at what point did you realise he had been shot?
When he told me what had happened. After I'd made the 999 call.
I think that's enough now, officer. Thank you.
I'll catch up with you later, Brenda.
So why have you been giving her risperidone?
She hasn't been sleeping. I told her there were sleeping pills.
I didn't ask how, I asked why.
You know why. She's delusional.
You mean she sees angels?
Yes.
Is this a regular thing?
For about the last 12 months.
Can you think of anything that's happened before this that might have triggered it off? I can't help you if you don't talk to me.
It all started when her mother died.
When did her mum die?
About a year ago last March.
So your wife dies last March and your daughter starts to hallucinate, and you don't see a connection there?
So what would you like to do when you finish school?
Move to Cornwall and I'd become a lifeguard.
Lifeguard, eh?
Yeah. The amount of women those guys get, you won't believe.
Yeah?
Yeah, like proper fit ones as well, not just any old bangers.
You must be a strong swimmer.
I can't actually swim yet. I'm hoping to pick it up as I go along, you know?
I'm sure the people whose lives you're trying to save will be perfectly happy with that arrangement.
Where's Brenda?
I'll fetch her in a little while, and the doctor needs to speak to you first.
Thank you, Nurse Conway. Rocco, you feeling a bit more comfortable?
I suppose.
Good. Well, listen, the orthopaedic surgeons have confirmed my fears, I'm afraid. The shotgun blast to your left leg has destroyed most of the shin bone, and you will have to have an operation.
So what, I'm going to have to walk with a limp, is that what you're saying?
I can't confirm anything yet. But I do need to make you aware that the worst possible outcome is that we amputate your leg just below the knee.
Amputate? Well, that means cut off, right?
That's correct.
No, I won't let you do it.
It's not definite, but if we don't operate, your leg will become infected, and that could kill you.
No, I ain't going to be no hop along, no way. Honestly, I'd rather be dead.
No, you wouldn't. So, are you refusing consent?
Haven't you been listening?
I think that's a big mistake.
I said no.
As a doctor, you must know that these hallucinations are a common symptom of grief.
I do know that. When Maya first told me she'd seen angels, I accepted it, but then she started seeing them everywhere. I mean, the college, on the street. It's getting out of hand.
So you drugged her?
I feared for her sanity.
Did you try talking to her?
First, all I got back was a pile of religious claptrap.
I take it you're not a believer.
Not anymore.
But even so, if Maya's angels help her deal with the loss of her mother, what harm could that possibly be doing to you or anyone else? You could have talked to her. But instead, you decided she had a psychiatric illness and gave her medication that almost killed her. What she probably needs is help with grieving. By that, I mean help from you. Her father.
Right. You were very lucky with this, you know that?
Have you seen a lot of people die?
Too many. For a moment there, I thought we were going to have to add your name to the list.
I knew I'd be safe with you around.
Don't you say that to all the nurses.
No. Raphael's with you. He's the angel of healing, and you're his instrument.
Instrument, eh? Probably a penny whistle or a kazoo, then.
You still don't remember me, do you?
No.
See this scar? Fell and hit my head. I must have been about 8. Mum and Dad brought me here, and you were the nurse who treated me.
Could well have been.
When I found out I needed stitches, I screamed, blue murder. Wouldn't let you near me. So you and Mum took me for a walk to calm me down. It was a clear night, and he pointed out the man in the moon to me. And you have absolutely no memory of this, do you?
Nope.
I don't mind. I've never forgotten you, or the man in the moon. That's you, Charlie. That's what you do. You don't just make people better. You make them feel better.
I've been saying that to this lot for years. Will they give me a wage rise?
Dad!
Hello, darling.
Hey, you don't look so worried. I'm not planning to die just yet.
It's not that, Maya. There's something I need to tell you.
Well, if you ask my opinion, sounds like a broken rib, and that can be very nasty, you know. You want to try not to laugh, cough, sneeze, or you're in absolute agony.
You a doctor?
No.
Shut your face.
Charlie.
Mr. Mostyn, we need to just take a look at that cut on your head. So, let's just pop you in here, shall we?
Oh, so sorry.
You were drugging me.
If Dr. Hannah reports me, it'll come out anyway. I thought you should hear it from me first.
I don't believe you.
I'm so sorry.
It was Mum who told me about the angels. When I was a little girl, don't you remember? How God created the angels to keep him company. 9 choirs of angels. And the greatest were the archangels. Gabriel and Michael, Uriel and...
They were just stories, Maya.
You believed them once.
I believed in a lot of things.
So what went wrong?
Your mum got motor neuron disease. You saw the way she died.
Dad? I thought you were coping.
No.
You miss her all the time, yeah?
I used to think God would protect me from everything bad. How naive is that? And then when your mum got ill, I concluded he couldn't exist. Because no loving creator would let anybody suffer the way she did.
I understand that.
You still go to church?
It's called faith, Dad.
Oh, I'm sorry. Seems more like madness after everything that happened. And then when you started throwing angels in the mix, I thought you were losing your mind.
No. I'm just really struggling. Same as you. It won't always be this bad. Will it? Dad!
We will get through this, Maya. Together. I absolutely promise you.
What's she doing here?
Well, you've been asking for her.
Yes, before I found out they might be chopping my leg off. Rocco, I'm so sorry. Should have just killed me. Why didn't you?
Rocco, listen to me. I know you're angry. But when all this is over, I will support you.
How?
I've needed help at the farm for a long time now. I could give you a job.
A job? Yeah. That's gonna solve everything. You've ruined my life today, you stupid cow. Get out!
Let's get you back. Come on.
So you picked this up in a road accident?
What's it to you, pal?
Just making conversation.
Don't.
Sean Muston?
Who's asking?
Well, obviously I am. I'd like to ask you a few questions about the road accident you were involved in. The boot of your car was full of electrical equipment, a laptop, a DVD player, radio cassette. Where did it all come from?
No comment.
What about this? You could try looking at it.
What about it?
Have you seen it before?
No.
Yet we found it in the boot of your car, Sean. On the same day, only 2 miles from where you were picked up, a teenage boy was shot by a man wearing a ski mask. Bit of a coincidence, don't you think? Sean, I'll talk to you again later. Okay.
Rocco, what should I tell Mr. Jordan?
Tell him I don't like his suit.
Okay, but what is about the operation that upsets you?
Maybe the part where they cut my leg off.
What else?
Just being an even bigger loser than I am already.
You're not a loser. You're funny and clever and handsome.
Yeah? Would you go out with the guy with one leg?
Depends on the guy.
Oh, I mean me.
Rocco.
Oh, come on, you just said I was handsome. Prove it. Take me on a date after they cut my leg off.
Come on.
Yeah, you just said I was handsome. I'm losing my looks pretty fast, don't I?
Don't you think you're just a little bit young for me?
Yeah. I am, so stop acting like you can. Just sling it, yeah?
I do care. You know, my grandmother was a nurse. She told me that back in her day, people used to call nurses angels. And that's all I'm trying to be. Your own personal angel.
Please, just quit it, yeah? Just please leave me alone.
Ah! Ah! Now you've blinded me.
Okay.
Fool!
Okay. It's no big deal. It's easily sorted. 5-year-old girls in here who've made less of a fuss.
What are they doing letting you near patients? You should be in an old folks home, you senile old git.
Is there some problem, guys?
He got acid in my eyes.
It's a little drop of glue. It's easily sorted. Do you want me to finish the job?
No, you are not touching me. He can do it.
Okay with you, Charlie?
Yeah, fine. Can I have a word?
Yeah, mate. What is it?
Keep an eye on him, Lloyd. He's just a bit unpredictable.
Will do, Charlie.
Thought I told you to get stuck in.
Well, I just came unstuck.
How come?
My charm ain't working, Charlie. To Today I'm not even half a nurse. I might as well just give up and go home. Fix myself a stiff G&T, put atonement on, cry myself senseless.
Scarlett, not a pretty sight, I know, but look at me. Do you think I got everything right when I was new to the job?
Bet you did better than me.
No. I was clueless. Little by little, I worked my way up to mediocre. It's taken me over 30 years to achieve my current level of unparalleled skill and absolute perfection. You stick with it. You'll be glad you did. I think you're going to make a very good nurse. You stick with it.
Rocco, man, what have you been saying about me?
I haven't said nothing.
Someone has. The cops are onto me. They're trying to say I was the one that shot you.
I haven't seen the cops. The doctors won't let anybody near me.
Must be that woman from the farm.
No.
Well, who else could it be?
Excuse me, you're not really supposed to be in here. Would you mind leaving, please?
Concussion is a funny thing. It occurs when the brain gets rattled about in the skull, rather like a hard-boiled egg being tossed about in a basin.
What do I need to do?
Plenty of rest. When I say rest, I mean do absolutely nothing.
That's impossible. I'm a farmer.
Oh, right, of course. Well, don't pay any attention to me. I'm only a doctor.
All right. Don't I know you?
No.
Yeah. I do. We met in your living room. You're the one that's trying to fit me up. Admit it. You told the police I shot Rocco.
I swear I haven't told the police anything about you.
You're lying.
How could I? I don't know your name. I've never seen your face until now.
You have now.
Help! I need help in here. She's been stabbed.
Let's get her through to recess. Right, keep your hands where they are. Don't move them. Let's get her up to cardiothoracics. Lift, please.
I'll get onto them.
Let's go. All right, okay.
Come on, Scarlett. Yeah, sorry.
All right, okay. Keep your hands there, don't move. Everything relies on you now, Scarlett.
But what could you have done?
I don't know. Something.
You treated a young man who then went on to stab someone. How on earth could you have known he was going to do that?
I had a bad feeling about him. I even mentioned it to Lloyd. Why not just do the sensible thing and tell the police?
Because the police need evidence, not feelings.
I feel I could have done more.
Join the club. You're one man, Charlie. It's a big, bad world out there. Come here.
Thank you, Mum.
Yeah, thank you. Bye-bye. Nick, how's Mrs. Tennell?
She arrested in theatre. But fortunately, they got her heart going again. She's in CICU. She's stable. That trick you did with your fingers, that's a pretty inspired piece of improvisation.
Thank you.
I take it you did sterilise your fingers before you inserted them into the wound?
Oh, well, Nick. There wasn't really any time.
I'm sorry, you mean you inserted dirty fingers into a chest wound? That will have to go on your record.
Pay no attention. I heard you were brilliant.
I believe you don't like my suit.
That's right.
Anything else you want to complain about while I'm here? I suppose you've heard about Mrs. Tennell.
Well, what about her?
She was stabbed a little while ago by your friend.
No.
Afraid so.
Please tell me she's not dead.
She came very close.
No. That's crazy. I mean, she did shoot me in the leg, but we were robbing a house.
Why would you do that?
It's kind of a test. Sean, that's my cousin. He thinks I'm not hard enough.
Well, your cousin Sean is an idiot. Do you mind me saying that?
No.
I think we can safely disregard everything your cousin has told you.
Okay. Listen, I'm so sorry about Brenda. I mean, as far as gun nuts go, she's actually all right. She's offered me a job.
Well, maybe you should take her up on that. As for the operation, I wish I could say for certain that you won't lose your leg, but I can't.
The answer's yes.
Excuse me?
I mean, you guys do what you need to do.
Good. Excellent. Why did you change your mind?
Do you believe in angels, Doc?
No.
Then you won't understand.
Here she is, the hero of the hour.
Oh, stop it.
You know, when I said get stuck in, I didn't mean it literally. Oh, boy, oh, boy, oh, boy.
Something wrong, Charlie?
Tough day, that's all. Not just getting older, getting past it.
You don't look it.
I bloody feel it. I feel like jacking it in.
Charlie Fairhead, don't you ever talk like that. You're the only reason I come to work. If you retired, this ED would fall apart. And I would have absolutely no one to moan to. Could I buy you a drink? Sort you out with it?
No, that won't work. Take at least 3 drinks.
Deal.